As a GP, this is the single most common question we're getting at the moment. I'm sure my colleagues would agree. The issue with the vaccination prioritisation is that it is set nationally. There is a committee, the Joint Committee of Vaccination and Immunisation, who decides which priority patients should receive the vaccine. Now, this priority list is readily available for everyone to see, and your individual GP or your practice will not actually have any say in that prioritisation list. In Group 1, the first group to be vaccinated, we're actually prioritising care homes. And the reason is the risk to care home residents and the staff has actually been shown to be much greater than anyone else. And the risk is serious illness and death. Group 1, the care home residents and care home workers, it is vital importance that they do take up the vaccination because of the level of risks. So I would encourage you, if you're in a nursing home, residential home, or you're working in one, it's really important that when you're offered the vaccine, and the offer will come to you, that you do take it up. Group 2, the next group down, will be the over 80-year-olds, so it's anyone aged 80 and over, and those who are in frontline health and social care work. Now, the frontline health and social care work is the only group where you may need to contact your local practice to let them know that you are a frontline healthcare and social care worker, because they may not actually know that. Everybody else will actually be contacted by the practice themselves to actually have the vaccination. So Group 2 is over 80s and those who are in frontline health and social care work. Group 3 is then 75 to 79-year-olds, and Group 4 is 70 to 74-year-olds, and those who would be in the shielding group. That's a clinically extremely vulnerable group. Now, if you're in the shielding group, you should know by now, if you're in that group, you would have been informed by your hospital consultant or your GP or another clinician by now. If you develop a new diagnosis, again, a clinician will inform you that you are in this group. And again, you should be contacted by the practice to have that vaccination. Now, some of you, I know, have come to us with queries about issues with friends that you know and neighbours who've had vaccinations before you have, and they're younger than you are. So you may have a 73-year-old friend who's had the vaccination and you're 78 yourself and you haven't had the vaccination. The reason that happens is purely dependent on the supply. They are trying nationally to coordinate so that roughly it goes in the same age groups across the country. However, there'll be times where some areas are given more of the vaccine than in other areas. But rest assured, you will have your offer of the vaccine in due course. There is a very public commitment which the Prime Minister has made, which you may be aware of, that all those in the first 4 groups I've just mentioned will have their vaccinations or be offered their vaccinations by February the 15th. So that's a promise that's been made nationally, so that's something you can expect. Locally, I can tell you we're making fantastic progress with reaching that target. Many of the areas are certainly doing their Group 3, so 75 to 79-year-olds, but are actually moving faster than that now as well. The speed at which we can go out is purely dependent on how much supply of the vaccine we receive. And that is obviously a national issue. There is the vaccine coming through each week, and we are delivering all the vaccine that we receive within the week that we're getting it. So we will get it out to you. We just encourage you all to be patient and wait to be contacted. Once you are contacted, please do take up the offer of having the vaccine. Most of you will be offered the vaccination at a general practice. The GPs are working together in groups called primary care networks, so you may be offered the vaccination at a site which is not your normal general practice. There are also other providers of the vaccinations coming through now, like pharmacies, so you may be offered your vaccination there. The most important thing though is that wherever you're offered the vaccination, you do take up the offer once it's received. You do have the vaccine.